Public Health Subcommittee meeting to order. Stand for invocation. Father, thank you for this time that you've provided for us. May we be ever mindful that we are accountable to each other, accountable to our people, but most importantly, we're accountable to you. May everything we say and do be pleasing to you. In Jesus' name, amen.
Amen.
Roll call, Shelley.
Yes, sir. Mike Robbins.
Here.
Bill England. Keith Austin.
Here.
Harvey Buzzard. Sean Crittenden. Taylor Duncan.
Ani.
Rex Jordan.
Here.
Mary Baker Shaw.
Bonnie.
Theo Smith.
Here.
Denise Taylor. Victoria Vescoles. Ryan Warner.
Ani.
We have a quorum. Reports, Lisa, Dr. Gaines.
Good morning.
Good morning.
Can you hear me fine?
Oh, yeah.
Thank you. Before you today, in the last meeting, what we plan to do today is follow up a little bit on our last Public Health Subcommittee. There were some questions on the heart disease report. We're going to review those. Counselor Warner had asked for a small report on public health, and we brought some executive highlights of our public health report to discuss. And we have a few things to talk about with the WINGS program, and then we'll be moving on. So, you'll have in front of you the Cherokee Nation Public Health Program highlights for April of 2019. And these are just a few of the things that we're working on. The Centers for Disease Control and Prevention was here in March, and they discussed, the director for the Centers for Disease Control and Prevention was here in March, and they visited the Cherokee Nation. I believe this is the first time the director of the Centers for Disease Control and Prevention has visited the Cherokee Nation. And he discussed both our priorities and the priorities for CDC, and it was a great meeting, and we learned quite a bit about his priorities and his focus on tribal public health. So it was a great visit. We're preparing for public health accreditation, reaccreditation to happen. That happens in 2021, but there's an enormous amount of work that goes into accreditation. We finished the strategic plan in January of 2019. We are working on tribal health assessment improvement plan. We're updating our compliance to FAB standards and measures right now. We're working on an updated performance management and quality improvement plan and a workforce development plan. We've completed the CDC Youth Risk Behavior Survey in 16 schools, and I believe we have one more left to do. We're preparing a new Cherokee Nation Cancer Burden Report in the partnership with the Hudson College of Public Health, the University of Oklahoma. We're preparing it's grant season, so we're preparing a lot of grant applications right now, both new applications and continuing applications in the Public Health Department. You have a report on the WIC caseload for March. We're working on the behavioral health, to help behavioral health support for the Tribal Opioid Response Work Group. We're working on ways that we can support that through small grants that we have. We're working with the Stillwell Clinic, Wilma P. Mankiller staff on a quality improvement project to determine the barriers to cancer screening for women. We're working with the Lynn Institute in the Stillwell community specifically to review and collect both quantitative and qualitative data. That's that deep dive that I've been talking about that we're doing, and that is going to be done in August, be finished in August of this year. We're working on at the administrative level a public health and clinical delivery integration model for tribes that CDC has asked us to share with other tribes across the nation. And our public health educators, which are located out in both at the Tahlequah campus and also across the clinics, are working on the Wings Fitness Club. They're working on a grant called Traditional Practices, where we do traditional games, traditional foods, and gardening. They're doing smoking cessation, farmers markets and gardens, and working on school diabetes projects with different schools across the reservation. So if you have any questions about any of that, please let me know. On the back is something that will be included every time I give you a report, and it's just the 10 essential services of public health. And it just is to give you a glimpse of the things that go on in public health. There are lots of activities under each one of those essential services that we define at a tribal level with self-determination, and then we have specific activities that we work on underneath each of those. Are there any questions with the highlights? Anybody?
Did you say this is the first time that CDC has been here?
The director of CDC, yes, yes,
That's a mouthful. First time ever.
yeah.
Are there public health educators in every one of our clinics?
There are not yet. However, there is, and actually the advertisement came out yesterday for a public health educator for Oshaleta, and we have put one in the budget for Nowata to begin in October. And then there will be staffed at every facility.
I know the Three Rivers, one of their public health educators recently have an opening there.
Yes, we'll be, Jason Sheeler, yeah, we'll be advertising for that shortly and working with Three Rivers Administration to get that filled, yes.
Other questions? Junior?
It's not really a question, but I just want to tell you how much the town of Vaya enjoyed all those runners the other day, and I hope everything went smooth.
I got some really good feedback about the Vaya Trail Race. It's the first time we've that we've sponsored a trail race like that, and I thought it was a great community event because in conjunction with it, you had the traditional games and you had a lot of different things going on. I think it did go smooth. The one thing I would say is that every time we have a race and it's the first time we have it, we have to guesstimate on how many participants we're going to have, and then the next year we order T-shirts appropriately. I think that was the only thing I heard was they ran out of T-shirts, and otherwise I heard a lot of good comments about it. So.
Yeah, they've come up there all soaking wet, muddy shoes, and said they had a blast. They'll be back next year.
Great, that's good to hear. That's good to hear.
Thank you.
Thank you.
Yes, thank you, Doc. Just really quick, and it's something that we go over a lot, and we talked about in our work group and stuff. Can you go ahead and just kind of throw out there the importance and reiterate what an IRB is, Institutional Review Board, and what, how important that is to some of the things that we do? Yep.
Sure. So, institutional review boards in the United States came to be, I forget what decade, in the 60s or so, when several reports came out about some abuses of human subjects in research. So, Cherokee Nation IRB is officially certified IRB. Their primary purpose is to protect human subjects from inappropriate research, both physically and mentally, from any abuses. Additionally, the Cherokee Nation IRB protects Cherokee Nation as a whole, our reputation, protect the citizens from being over-researched, and to make sure that any research that occurs in Cherokee Nation is needed by the Cherokee Nation and is some benefit. So Dr. Khan and his team on the IRB do a fantastic job of not only making sure that appropriate research is done, but that it's extremely high quality as well. So they're a tough bunch. Nothing gets past them at all, and they're very, very busy. Because Cherokee Nation is so functional and we have so much good data and people that care about our health, the researchers are begging to come help us take care of our people, and Dr. Khan and the IRB really keep tight control on that. And additionally, any publications that come out, even internally, this heart disease report before it goes out to our health partners will be reviewed by the IRB just to get their stamp of approval that this is appropriate, and there are things in here that Cherokee Nation wants to share about itself. So that's what the IRB does.
Thank you. Thank you, Doc.
Any other questions at this point? Go ahead, Lisa or Dr. Gann.
I'm going to go ahead and turn it over to Dr. Gann. Last time we were here and we presented the heart disease report, there were several questions, follow-up questions, and Dr. Gann has prepared some responses to those questions.
So I sent out an amended report, an amended summary with some additional slides, and I highlighted those slides on the document I passed out that has 2 slides on the front with the blue. So I just want to go over those slides real quickly because, like that. So on page 1, slide number 2, the percent of deaths from heart disease in people less than 75 years old. And here I compare Native Americans in Cherokee Nation versus non-Native Oklahomans and the U.S. general population. You can see the disparity there. In Cherokee Nation, 53% of people who die from heart disease are less than 75 years old, compared to 40% of non-Native Oklahomans, and in the U.S. general population, 34%. on page 2, slide number 3. It's a proportion by gender of Native Americans in Cherokee Nation less than 75 years old who died from heart disease. It's kind of a mouthful. So if you take all the people in Cherokee Nation who died of heart disease who were less than 75, 2/3 were men and 1/3 were women. So there's a disparity there. On slide number 4, percent of deaths in men who died from heart disease who are less than 75 years old. So of all the men in Cherokee Nation who died from heart disease, 63% were less than 75 years old, compared to non-native Oklahoma men, whereas 49%. So you can see the disparity there. And then the last slide is the same for women in Cherokee Nation versus non-native Oklahoma women. In Cherokee Nation, 41% of the women who die from heart disease are less than 75, where in non-native Oklahoma women, it's 30%. There's a lot of different ways to stratify the data. If you want some more different looks at the data, I'd be happy to provide those. Let me know, and we can generate that information. The final big report, we're adding a few more things to it, and like I mentioned, it's more of an academic report that will go out to our health partners at the university, the Tribal Epidemiology Center, the Indian Health Service. We're adding a few more things. The University of Oklahoma College of Public Health has been our partner in developing this report, so they're helping us finalize it, and we'll have that sent out to our health partners and make it publicly available in the next month or two. So I think the bottom line on heart disease, and we talked about before, it's physical activity, nutrition, and tobacco use, right? That's the three big ones. So every opportunity we have, we bring that up. And of course, I ask for y'all as well that have the pulpit, when you have the opportunity, you talk to your constituents about cigarette smoking, number one cause of preventable death and disability in Cherokee Nation in the United States. And the activity, the trail run in Vaya, it's a beautiful family activity, promote those, and nutrition, right? So having a bottle of water with you when you stand up to speak sends a message to everyone who's listening. And just talking about cigarette smoking and healthy foods. Springtime is a wonderful time to talk about healthy foods when people are trying to decide whether or not going to put in the effort into a garden, and the farmers markets are opening up. It's great for local business as well as for the health of the community. So it's a great, great opportunity. Any other questions on the heart disease report?
Well, you mentioned nutrition, exercise, and tobacco use.
Yes, sir.
How would you characterize our nutrition efforts to our citizens? I know we do a good job with diabetics. Every recall diabetic appointment, there can be a nutrition seminar with them. What about our how would you characterize our nutrition efforts in our clinics?
Do that. Well, I know that all the clinics are staffed with dietitians for the patients to see, but on a public health level, what we are doing with nutrition, as I talked about earlier, some of the work that we do with traditional practices, gardening, looking at traditional foods, also increasing access to healthy foods, healthy and fresh foods in communities is a big piece of what we do. Some of the school grants that we talked about, some of those work with school cafeterias on finding ways to deliver healthier food and produce healthier food for children at school. So there's a variety of projects like that. I know also the diabetes prevention program that's under Tara Ritter and DPP under Tanya Wapskinny. They do a Healthy Native program that teaches nutrition is a huge part of that 16-week curriculum and the maintenance period of it. So there are a variety of efforts going on with nutrition. There's a lot more things that can be happening, and those things we're constantly looking at how we can increase access to healthy foods. You see the farmers markets that are going up around the communities. We work with those too to try to help the farmers markets get started if there is need for that. And so there's a variety of things we are working on and trying to do, and certainly lots more work to be done. So.
Yes, thank you. I've been trying to, or wanting to, get an above-ground garden built at our housing, Indian housing in Bonita, Buffington Heights. there are several people that live there would love to garden and produce the food. And the budget crisis with our housing authority has prevented anything of that nature. We talk about it, we'd love to have it, but we can't do it. Is there any other way we can do that, like maybe through your efforts?
I think there's a possible way. If you'll email me all the specifics, I can look
Right.
into it and get back with you and make sure I can see what I can do. Yeah.
Thank you, Mr. Chair.
Any other questions? Okay. If you'll allow me on the program highlights, I missed one thing that I wanted to highlight. When the director of CDC was here, one of the things that he highlighted was the national success of the hepatitis C elimination project here. That's under Dr. Mara. And one of Dr. Redfield, who is the director of CDC's goals, is elimination of HIV by 2030. And he believes that our hepatitis C elimination project is a model for the rest of the nation. And so as we see that coming forward, I know Dr. Mara and I have been in conversation, and he's already working on plans for HIV elimination and doing a summary of what we're doing now and where we need to go. So just wanted to mention that quickly. After the heart disease report, I know we're on a time limit today, but after the heart disease report last time, we did have a lot of discussion around the risk factors, and one of those is around physical activity and what we can do to increase physical activity across the reservation. And I wanted to bring you an example because when we do physical activity programs, we use what's called best practices or evidence-based interventions for communities. And it's a national resource that's quite a few national partners. It's the communityguide.org. And what they do is they take all of the research from across the entire United States and they make recommendations based on all the research that's out there about what's effective, what's not effective, and what still needs to be where there's insignificant evidence that it works. And 4 of their recommendations are organize community-wide campaigns about physical activity, teach people how to change behaviors and develop supportive social environments, combine activities with health education to build family support and increase physical activity among children, and make community design that supports physical activity such as sidewalks and trails and different community design. So what I wanted to do today quickly is to bring you, we talk about the WINGS program a lot, and the WINGS program is based on one of those evidence interventions, teaching people how to change behaviors, giving them more access to that behavior, and then developing the social support for that behavior. And I gave you a couple of things with the WINGS program to show you. One, you have a map, and this is the February numbers. It looks like this. And this shows you the WINGS membership distribution across the counties so that you can see where most of those WINGS members are and how many are in your particular areas. When you see the next time we pull these numbers, they're probably going to be higher because we've just started a new Healthy Cherokee race series, and you have that in front of you too. You have both the WINGS 2019 schedule and you have what's called the Healthy Cherokee race series. It's a 4-month project that we're doing to try to increase WINGS membership, and there's specific races that people can sign up for, and if they go to a certain number of them, completed 7 of the 14 WINGS races, then you receive an award at the end. So we're trying to, and when I talked to the WINGS coordinator, she says that they're getting a lot more applications, so we're probably going to see the numbers increase over time. And just to give you a little bit of context, the WINGS program has been around since 1996. It is not a national program, so to speak, but it's an individually developed here at Cherokee Nation type program. We actually, the program is open to anyone that lives within the reservation, and they can sign up, fill out all the forms, and they can attend any WINGS-sponsored races without any charge. And we sponsor around 26 races a year, and what we do is we actually put the race on ourselves. And if you're a WINGS member, you can come to that at no cost. And we partner with local organizations to do that in each of these different communities. And so we try to pay special attention to the WINGS schedule every year. It's changed in the last few years. We used to actually go to already sanctioned races, and then just pay a fee, but we decided to keep it more in the community so that we could sponsor the race. We pay for everything and then allow all Wings members to come so that the family members and children and neighbors can all come to that. So last year, in 2018, there were roughly 5,700 participants, and we only had 21 races last year. So I wanted to make sure that you guys were familiar with Wings a little bit, and there might be questions about it. I get a lot of questions, and it's just one of the examples. It's one small piece of the program, but it's been around for quite a long time, and it's pretty well received by most people, and we hope to see it continue to grow and look at some different activities. And it's not just running, it's also walking. We have a big group of people that walk each of the races or the fun runs. So, are there any questions about the Wings program that I can answer today?
Just more of a comment. I want to say that, when she mentions those important factors, that socialization factor, when we went to Vaya last week, you've got, I looked around and you've seen all these different groups of folks that were from, and we had a big group of CrossFitters that were there, and my family was there, and just different, and you see how they all just kind of trickle in. They may not only see each other at those races and stuff, but in our area, my wife, and then, they started up, it's not an official club, but they started running, okay, and it started with 2 ladies. And then now, over the last 6-7 years, the group, it expands, then at certain times of the season, some of them, it shrinks back down, but it's still going, and they always know, and because I hear that phone go off at 4:30 every morning, hey, who's getting up to run, who's doing this, and just by taking our sons there, I'd entered up Luke, my 8-year-old, into the fun run. Well, he runs the fun run, and then he jumped back in line and ran the 5K as well. Just because he was just there and he saw all those people. So I think that socialization, that's one of the big keys in this. But it's awesome. When you look down here, you got May 11th, the Run for the Berries. I know that's always a big run. And here's the thing for me. All these runs, they're early, but people get up, and it's good to get up early, and it's good to get moving and get motivated. So I want to say, thank you guys for, keeping that stuff going. Appreciate it. Thank you, Doc.
How early is early, Brian?
4:30. Yep.
Hey, Brian, tell
7:30. Yeah.
tell Lisa about the lady that was training for the marathon, that the other ladies would run a part of that with
Yes.
her when she was training.
Right. No, and I mean that's the thing. We've got several that, a lot of these marathons, they qualify and they so forth. So they get this group, and they all start, they start fundraising, but throughout the whole months and everything, people at different times come in and say, hey, I'm going to run with Amy on this day for this minute, and then they start at like 3 o'clock in the morning, and then my wife would get up and hit the 4:30 mark, and then they'd have another group that hit the 5:30 mark just so she could get in her miles. And that's to me, that's what it's really all about. And kudos to those ladies that are doing it. There's a few men, but as you see on the heart study, there needs to be a few more men, and even if it's just walking, I would like to hear a little bit more about, so you talked about the CDC coming here. How about when they ask you to come out there?
Yes. After we presented here to the director of CDC, I was asked to come. I was going to CDC anyway for some other meetings, and I was asked while I was there, if I would present to the CSTULTS. It's the Center for State, Territorial, Tribal, Local work, and I was asked if I would present to their leadership about the Cherokee Nation. And so I did that. I went last month and took the Cherokee Nation and all the great work that's going on throughout all of the Cherokee Nation and talked about that. And I gave the leadership team at CDC a lot more information about the historical context of the Cherokee Nation. I talked about who we are, where we've come from, and all of the things that make us a great nation. And they had quite a few questions. They were pretty interested and didn't know a lot about. Actually, I think sometimes people that are not familiar with tribal work, they think about all this stuff happened in the 1400s or something. They don't realize, and I was telling them, both of my grandparents were original enrollees. This has not been hundreds and hundreds of years ago. And so I provide a little more context for them about what we do and who we are, and I was very honored to be able to do that for us. Thank you.
I think another important thing too, they mentioned that hepatitis C elimination project. If you haven't ever got a chance to listen or talk to Dr. Mara, the way they set all this up and the way that they strategically went about everything, it really sheds a lot of light on some of the great things that we're doing, and that's not going on anywhere else in the country, but it's going on right here in Cherokee Nation. So it's something to be proud of, and these people are top notch, you know, and I mean, and they've got lofty goals, but they find ways to meet those goals, and I think that's something that we can all look up to.
I would just say about that, and I believe that our role as conveners for public health and tribal public health, and one of the things that I did remind them of is that trust responsibility is for health, and that didn't mean just medical care. That meant the health of our population, and that we asked them to honor that trust responsibility.
Any other questions? You have further,
I do not. Thank you.
Dr. Gann?
No, sir.
Okay, well, we'll be adjourning here shortly. Could you touch on, the work group within the Public Health Subcommittee met last? It seemed like we came to the conclusion to charge you with a focus group to kind of lead us out of the wilderness. I think we provided input. I think you kind of have a sense. Seems like counselors had different views, what would be best for their district. Where are we on that? Have you got a focus group kind of pieced together?
Well, what we're doing with that, and we want to make sure that that is done, we're trying to partner with someone externally. So we've reached out to a couple of our partners, and we have one in particular that we've reached out to at a university who's done an enormous amount of work in physical activity and community differences in access and community differences in participation. And we've asked them to put together somewhat of a backup proposal back to us on what it would take to do what it is we need to do, which they asked us, are you asking about the Cherokee Nation as a whole, or do you really want to know about differences by district? And I believe that's what we want to know about, is differences by district for physical activity, both access, participation, and then developing the qualitative part or the community feedback piece. So I'm hoping to have that within a couple of weeks back so that we can get moving on that particular piece. But yes, we are working on it.
Great. Have you got a sense for any funding, what that focus group's going to entail, or?
Not yet. No. That's what I'm waiting for to kind of get an idea on what we think that would take to do that.
Appreciate that update. Any other questions regarding our work group endeavor? I think at this point, I don't think our work group needs to meet till we hear from this focus
Okay.
group, I believe.
Yes.
Other questions?
I'm just thankful we've got them.
Yeah.
In summary, I think a couple of you aren't on the work group. We're exploring private partners to couple with the Cherokee Nation to provide exercise options outside of Tahlequah. And different counselors have different needs in their districts, and so we're going to, hopefully this focus group will kind of outline ways in which we can go forward. And we're going to try to in a timely manner. We were kind of looking to be included in the 2020 budget, so we're on a pretty tight timeline.
Yes, whenever we do focus groups, the one piece of it, they do have to be approved by the Institutional Review Board. We always send them through the IRB, both for structure questioning to make sure that they meet the standards for that too. So once we get that piece together, we will work with Dr. Kahn to get that expedited.
Okay, great.
And their feedback. Yes.
Okay. Any other questions? Old business, none. New business, none. Next meeting is tentatively scheduled Tuesday, June 11th at 9 o'clock. I would entertain a motion to adjourn.
Second.
All those in favor? Aye. Good job.